Exercise. Let's talk about something exciting today. Well, physical activity is exercise when you move those skeletal muscles with contraction and you have energy expenditure beyond what's baseline. However, exercise, more defined like a purposeful physical activity that's organized, planned, routinary, and the objective is to improve or maintain different aspects of your health. So let's get into this. Now, sedentary lifestyle, get off of that couch, because physical activity in any form is better than none. Staying very active, we now know, promotes longevity, how long you will live, the quality of life you'll live, heart attacks, if you'll have strokes. It decreases even insulin resistance. It promotes epigenetic modifications that can promote anti-cancer gene expression. Physical inactivity is now the fourth leading risk factor for global deaths. People who are overweight, class 2 obesity, we note that they can actually have 4 years of life loss. And it's the same for people who have normal weight, but who are inactive. Remember that. The same as a class 2 obesity, someone who is a normal weight, who is inactive. Now, we notice that people with depression have a smaller hippocampus, which is really an organ in the middle of the brain. But while exercising, we notice that these people actually improve the size of their hippocampus. A study done looking at 156 patients who are depressed into a randomized 3 different groups. One with aerobic exercise, that group, for 4 months, just exercise alone for 4 months. The other group had treatment and exercise for 4 months. And the third group had exercise and treatment for 4 months. At 10 months, all exercise groups had increased risk factor for depression. Those who had medical help with medicine had a quicker response, but the one that sustained, the group that sustained a reduced symptoms of depression, these were the ones who had exercise involved in their therapy. What does that tell us? That becoming physically active can reduce your stress levels and control to some degree your depression. Now, your perceived level of stress can be directly affected by your physical level of fitness. And what about diabetes? Well, the American Association of Diabetes had a study of 3,000 patients who had abnormal glucose levels. And they put them either into a group with metformin or one with a lifestyle modification program and physical activity. At least 150 brisk walking minutes per week. And they also had a reduced calorie diet, which were monitored over 2.5 years. Guess what? The lifestyle modification group had 58% lower risk of contracting type 2 diabetes. You see, the positive gains from physical exercise for patients with type 2 diabetes are very well documented. And there is an international consensus now that physical activity is one of the 3 cornerstones in the treatment of diabetes, along with diet and medication. It's not just diabetes. When we look at hypertension and coronary heart disease and exercise, overall, it is well documented that training for hypersensitive people induces clinically relevant lowering of the blood pressure. Well, conventional treatment using blood pressure lowering medications, they typically bring about a decrease in the diastolic blood pressure of the same level as what happens when you have physical activity from exercise. That tells us then that it should be the major cornerstone in treatment. Solid evidence on demonstrating the effects of physical activity on a patient's coronary heart disease. We find that physically trained persons, their survival rate and also their quality of life is improved. And so people who have heart disease should not feel that they cannot have physical activity. They should certainly speak to their primary care physician first. Now, we also know that people who have type 2 diabetes should be cautious, because these people need to have exercise because it actually helps to improve their insulin resistance levels, increases their metabolism as well, helps to regulate their blood sugar throughout the day. And also, it helps to decrease the amount of fat in their body.